If you tried everything for your pain and nothing has worked, this is the video for you. Hi, everyone. I'm Robert, hypnotherapist and pain management specialist. And today I'm going to talk to you about how the mind works, just a little bit with pain. Now, the reason why you may have not had success with your pain management journey, especially with the medical field in certain situations, is because a lot of the stuff that they're treating is not of the body only, if that makes sense. I specialize in fibromyalgia, TMS, chronic pain, and acute pain, but mostly chronic pain. Now, the reason why pain medications either don't work a little bit, this one works for you, this one works for them, everybody's different with the stuff, is because of the subconscious mind. Chronic pain is not something that the human body should be dealing with every single day. Now, pain is a normal expression of the body, but it's a warning system. Yes, it's a, hey, something is wrong going on here. But with chronic pain patients, a lot of the times there's nothing wrong. Or the issue that is being blamed on the pain is not actually the pain problem. For example, a slipped disc. A slipped disc. Now, there are people with slipped disc in the world that have no idea they have slipped disc in their spine. No idea. No pain at all. And there are some people that have slipped disc and have a lot of pain in the area. Why is this? Why do people with the same issue in the same area not have the same result, the same pain threshold, the same pain experience? It's because the subconscious mind could be playing a trick. And it's not really a trick, it's a survival adaptation. It's something it's doing for you, it's for your benefit. Supposedly, or believe it or not, the pain could be for your benefit, and this is why. Chronic pain, like from fibromyalgia, TMS, or pain that still resides, or you're still feeling pain after an acute injury, like a broken bone, a pulled muscle, something like that, where it is completely healed, but it is still painful, is because you have been trained or sensitized to the pain. That could be the acute thing. The chronic thing, and this is something that's crazy, is your subconscious mind expressing itself. Now, the problem with this is it expresses itself in a way that is a distraction to you. Because if you have TMS, fibromyalgia, sometimes irritable bowel syndrome, depending on what's going on, it could be subconscious pressure, negative emotion, rage, pick your vernacular. It's something negative in the subconscious mind that's being suppressed. And it's being suppressed and is building up and building up. And if it gets close to the surface, to where you might actually have an understanding of what's going on, then it may create a painful situation to distract you because people will focus on the pain more than anything else. Now, it does this because it is deemed the problem in the subconscious is too dangerous for you to know about it. And it's, according to Dr. Sarno, it's rage. From my training, from my background, it could be a lot of negative emotions, but build up to that. Anyway, that's a whole other thing. Now, these negative emotions build up and build up and build up, and they ruminate in the subconscious mind, and they need to be expressed some way. Otherwise, it could develop into a bad situation. Like, there's science now that some autoimmune diseases could be linked to subconscious issues. That's a whole other video. I'll get into that one day. But subconscious issues being expressed in the body to distract you from the actual issue. Because it might be rage, anger, some issue. Your subconscious has deemed it too dangerous for you to know about it, so it hides it. And if it gets too close to the surface, it creates a problem for you to focus on instead of that. Now, just knowing that could beat that problem. Because once the subconscious knows you know the gig is up, it might change to something else, and you have to do something else with that, depending on the person. With this kind of stuff, people who resolve their pain could develop anxiety or depression or something like that because now it's being expressed in a different way. Or vice versa. Somebody working on their anxiety, depression, getting to the root of that, could develop painful issues to be distracted on. It's crazy. But the subconscious is doing this because it deems the emotion too dangerous for you to know about. So it creates physical problems and issues. Now, the mechanism to this is the mind creates the pressure, right? The thought, the holding back of emotion, the not lashing out, the not saying what you need to say. The people pleasers, the high stress, the high tension people, the ones that always need to be perfectionists, and there's more, of course. There's more personality traits. But these build up tension, stress over time, and is expressed in the body. Now, the mind creates the pressure, right? The perception of the person has creates the issues. They're not expressed, they're held in the body. Anything not expressed is held in the body, especially negative stuff. If it's not dreamed out, if it's not vented out, it is stored and it is not processed, but it rolls around in there. So it gets suppressed, it goes into a part of the body, and it typically causes tension, pressure, strain. It causes muscle, tendon, or nerve strain or tension. I keep going tension. There's another word I'd like to use, but I can't think of it right now. Anyway, tension in the body, stress. And what that does is it causes mild blood oxygen deprivation. Okay, it restricts the blood, which restricts the oxygen, which causes issues in the body. Now, according to Dr. Sarno, and I have other training, in the background, but I'll talk about Dr. Sarno stuff right now. According to the good doctor, this is not really that dangerous because it's mild oxygen deprivation from blood restriction. So when it's released, when the pressure is released, when the tension, the muscle is released, average blood flow returns and health is restored. Now, this works by, you don't have to express the issue down there, but you have to learn that it could be there. And in certain cases, it can be expressed, it can be vented, it can be changed, depending on what's going on. The intervention that I have developed, it has an educational part to it. It has a hypnosis part to it, obviously, because I want to get to the subconscious mind and help you deal with these issues that are causing you the fibromyalgia or the TMS. And I give you self-hypnosis. I teach you how to use hypnosis yourself for future problems and for pain management, obviously. Now, 1 to 3 sessions and we're done. And then you go about your journey. I'm not the kind of therapist that wants to see you for years on end. No. I help you out the dark place. I tell you how to do it, and I show you how to do it. That's how we do it. So, your pain, your fibromyalgia, your TMS, IBS. There's a lot of mind-body syndromes out there that we're discovering more and more, because the human psyche will suppress so much, especially in the Western culture. We suppress so much that it has to express in different ways. There's a whole saying, what is suppressed is expressed. Or whatever is secreted away is secreted in the body. Secret and secret kind of spells similar. Maybe there's a reason why. Anyway, when you have dark secrets, when you just hold them into your body, when you hold stress, when you hold tension, anger, stress, anything negative in the body can cause issues eventually if it builds up. If you don't express it, maybe you don't change your personality in time, and something builds up too much. There's so much into this, but the point to this video is your pain may not just be physical. Even if the pain is being blamed on something physical, like a slipped disc or a rotator cuff, that's something that I'm still trying to figure out myself, because according to Dr. Sarno, a rotator cuff tear doesn't have to be painful, because there are people who live with rotator cuff tears and they are not in pain. Same thing with slipped disc, like I said earlier. So what's going on here? The mechanism here is the subconscious is looking for reasons or ways to express the pain that is a link to the rage or the negative emotion in a way that you won't know that it's actually an emotional problem. How it does this: it will choose a site of an abnormality, like a slipped disc. Now, people don't know this. I didn't know it till a while ago, but I didn't know it for so long. A slipped disc does not automatically mean pain. There are people with slipped disc in the world right now who have no idea. So what's going on? If you can have the same situation with no pain, what's going on? The mind will choose the site of an abnormality that it knows will be blamed for the pain. So, let's say you're bending over one day, right? You bend over to pick something up, the same freaking motion you've made your whole life. But this time, you get pain in your back. It goes out, whatever. It can't go out, apparently, according to Sarno. But anyway, it goes out. You're in so much pain. You go to the doctor. The doctor does an x-ray, finds a slipped disc in the same area of the pain, and it blames the pain on the slipped disc. But people who have surgery to fix this still have the same pain. What's going on? The mind is very tricky. The subconscious doesn't want you to know about this suppressed emotion because it deemed it too dangerous. So it picks its opportunities to kind of vent out a little bit of stress or emotion. It kind of screams when it can in ways you don't understand, or in ways you don't recognize. And one of the main ways to recognize or to notice that this is an issue for you is, does your pain change? Does your pain have different levels of intensity throughout the day? Is it worse in the morning? Is it worse at night? Is it worse when you do something? Is it worse when you're not doing something? Because that's another component. You could be trained to experience pain at certain moments, like a Pavlov dog. It's true. It's true. This is hypnosis. This is more of a hypnosis thing that we can get into with being trained and conditioned, whatever. But why is it that you could go, I don't know, for a mile walk and have no pain, but when you brush your teeth and that slight bend over hurts? Or sitting in the chair, it's fine, but sitting in the computer chair at work compared to your home chair hurts. Same thing, but why? Because you're conditioned to feel pain. You could be conditioned to feel pain in those moments, in those situations. It's nuts. All of this can be explained and kind of not done away with, but kind of dealt with in the best way. I don't like to say done away with, because the subconscious is always doing something in your favor, even when it causes pain. So I don't want to do away with it, but to deal with it, to address it. That's the word. I want to address it. Hypnosis can address all these things and help vent out and reprogram and re-examine how you see the world. Maybe there's something stressing you every single day that we can change, and you just have a better life in general, because you're not having as much stress build up throughout the day, throughout the weeks, throughout the months. And you have self-hypnosis after working with me. So you can vent out stress. You can make small changes to yourself over periods of time. Like, you won't be stuck anymore in things that you don't want to be in. People are stuck in their own patterns, their own ways. Self-hypnosis helps get you out. So working with me, you get education on the subject. I have a whole slideshow. There's a whole presentation, because education about what's going on here is part of the help. It's part of the intervention. Education. And then hypnosis. Certain ways of I do about 2 sessions of hypnosis, different ways. One is more direct. One is more conversational. There's way more to that. And then the third session is self-hypnosis training. You get empowered with me. I don't want to see you for years and years and years. I pull you out the dark place. I teach you about it. And then I send you on your way with the tools to keep going yourself. And one more thing I will say about the pain management world. Stop identifying with it. That is my advice. Stop identifying with it. Stop saying, I have this, or I deal with this, because you are reinforcing the subconscious expression. You're reinforcing it all. And when I hear people say Fibro warrior or TMS warrior, they're adopting that as kind of a shield, I believe, because it's easier to deal with when it's part of your identity and you're fighting with it or you're dealing with it. I get that. It becomes part of the identity, but that can lock you into longer periods of having pain. Please understand that. Like, every time you say, I this, or I am this, I have this, your subconscious goes, okay, let's keep going with that. You're locking yourself into programming. Of course, before you can see me, you got to go to your doctor, get examined, and I send you a referral to see me from the doctor, of course. Now, if there's any questions, please send me an email, waltonhypnotherapy@yahoo.com. Check me out. Check out my other website, ineedhypno.com. It's a contracting site. I got a bunch of therapists up there waiting and willing to help you with so many different things, so many different specialists, audios, free audios, all kinds of things on ineedhypno.com, and my personal page, waltonhypnotherapy.com. I do pain management on both sites, so it doesn't matter which way you go, okay? Any questions, please email me. I have other stuff on my other social medias. Check them out. LinkedIn, Facebook, I need Hypno, Walton Hypnotherapy. A little bit of YouTube videos. I got more of these out there. And Instagram. Instagram is the biggest one I got. I got 10,000 people on Instagram, and then like 400 or 500 on the other Instagram I have. I Need Hypno is 10,000. My body therapy has a few hundred right now. Check them out. Like them, subscribe, whatever you want to do. I really appreciate you guys staying on the video this long if you did. I hope you understood what I was saying. Hope you learned something. Because there's so much more to this. There's so much more to pain management and helping people with the subconscious than what I just said in the 15-minute video. So, if you want to know more, let me know. Reach out to me. I'll answer any questions. I'll give you resources. I'm not just I know everything, blah, 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 blah. No. I will give you resources if I have them, okay? So, take care. Have a great night. Thanks for being here.